Hi, everybody. As Mara told you, I'm a board-certified plastic surgeon in the New Jersey area. I have been involved with Bayshore Hospital in the medical executive committee for some time now, and most recently, it's given me an opportunity to see what's going on, both from a perspective of the clinicians as well as the administration in terms of dealing with the COVID pandemic. And suffice it to say, it's been a challenge trying to negotiate the demands from the patient needs, those that have COVID, as well as those that don't, and trying to negotiate how to take care of patients effectively with the resources we have available, making sure that we have enough PPE, of course, for all of the physicians and nurses and providers alike, and also trying to make sure that the emergency room runs smoothly from a perspective of seeing patients and triaging them and potentially getting them in and out of the hospital as safely and quickly as possible. Currently, Bayshore Hospital has approximately 100 patients in their facility with either confirmed coronavirus infection or presumed coronavirus infection, still awaiting some test results. That number fluctuates literally every day, and we have daily phone calls as a medical executive committee to discuss who's in-house and who's potentially been discharged, how many people are on the ventilators. And for example, we've got 14 people on the ventilators now. We have been fortunate to get some new, or more rather, ventilators sent to us from the national stockpile. We are part of a larger healthcare system in New Jersey that's called Hackensack Meridian Health. And that also gives us some ability to move around some of the resources, whether we're talking about personnel or we're talking about actual structural stuff such as ventilators and supplies. The interesting thing is realizing that as this area specifically has been dealing with the coronavirus issue for approximately a month, maybe even 5 weeks now, seeing some of the transition from perhaps the initial anxieties and uncertainties of what dealing with a coronavirus patient would mean to now potentially transitioning to trying to figure out how to function with coronavirus patients, looking at some of the ingenuity that's come up with the use of plexiglass type boxes that have been made by the engineering department in the hospital to allow for the anesthesia and or emergency room teams to intubate patients. So what that means in basically plain English is that when we're going to put in a breathing tube in somebody, typically speaking, that's done under direct visualization, where a blade, almost a curved shaped blade, goes inside the patient's mouth to lift up their tongue and expose the vocal cords so the anesthesia doctor or physician intubating can put in that breathing tube. In light of the fact that coronavirus is clearly a airway infection that has a high exposure rate for both the person putting it in as well as anybody and everybody around them at that time. So an interesting thing that's come up is that there is now in our hospital an immediate need to get something called a glidoscope. And a glidoscope is effectively like a video-enabled and video-assisted intubation device. And so by putting this clear plexiglass box on top of the patient's head with 2 holes for the physician to put their hand through, now they have this plexiglass shield, and then using this glidoscope, they can potentially intubate the patient with minimal exposure to the provider and potentially even those in the same room. So it's just ultimately a point of interesting to see how things are changing. The hospital's trying to make new negative pressure rooms to be able to handle a higher number of patients, so that negative pressure, basically the air's coming into the room so that nothing's coming out of the room essentially. So they're looking at that infrastructure. And, I think in the outpatient setting, it's also interesting to see that how quickly these outpatient testing centers are getting bombarded with patients. It was a bigger problem here in New Jersey, I would say about a week ago. One of the one of the testing sites that opened up relatively close to my home is a outdoor concert area, kind of like the Woodlands Pavilion, Maher, which would mean something to you, right? So this place is called the PNC Bank Arts Center, and they opened it up for a drive-through testing site, and it was overwhelmed and closed in 20 minutes, just to kind of give an idea of how crazy that rush of people to get tested was. So we still are, I think, dealing with trying to make sure that there's enough testing available for patients. There does seem to be a lot of, thankfully, ingenuity and innovation that's going on. I understand that there is a rapid coronavirus test that is now available, similar to a rapid strep test or a rapid flu test, for example. That's something that is being employed as of, I think, yesterday in our medical center. I think that, one of the things that we've been talking a lot about, of course, is how to harness the brain power, the ingenuity, and the know-how of this Pillar Tribe, network to see what additional benefits we can give our community as a whole.